Many people are suffering in silence.
The worst moments have been, persons being brought in, they are tied up in ropes, or you're called when they've been locked up.
They're always viewed as a threat.
Nchini Kenya, inakadiriwa kuwa mtu mmoja kati ya watu 10 anaugua shida ya kiakili. Idadi inaongezeka hadi 1 kati ya watu 4 kati ya wagonjwa wanaohudhuria huduma za wagonjwa wa kawaida. Je, watu wengi wanajua ugonjwa wa kiakili ni nini?
It is the internal fabric or the internal health of an individual when he is not in conflict, first of all, with himself. That is when we say an individual is mentally healthy. He is at peace with himself. And also he is not at war with himself. So that particular time we can say this person or this individual is mentally healthy. Now the opposite of that is true. And the mental is composed of 3 things. It has the mind, both the conscious and the subconscious. It has the will, and it has the emotions. Those are the 3 things that encompasses the psychology of a human. So when these 3 things are conflicting, there is conflict in the mind, there is conflict in the will, and there is conflict in the emotions, then we say that person is mentally unstable.
Kukua katika familia isiyo na upendo, kukataliwa na pia kejeli za kijamii. Zipora Wambui amepitia wakati mgumu, kwani familia yake imekuwa ikiitwa uenda wazimu.
I've grown up in a family where there is mental illness from my biological mom, my dad, and my elder sister. My sister had problems even when she was young, but we never really knew what it was until the year 1997 when she was first admitted at Mathari Hospital. It was scary because when you are young as a child, you don't know what is wrong with your parent until you're out there playing and other kids tell you your mom is mwenda wazimu, or you see people beating her because she has picked something on the road, maybe a banana from a market woman, and you have to signal the person that the person is not okay. So we grew up with the help of well-wishers, but most of the times we were on the street because mom is not working, and she would carry us with her when the illness struck.
George Maina ni miongoni mwa wazee wanaoishi katika jamii yenye kuhukumu.
Since 1995, that's when I started my medication. It's been taking me well. Okay, I've been in and out of hospital, but my family takes care of me.
Na ni nini tunachokifanya ili kuweza kukabiliana na ugonjwa wa kiakili?
The first stop a church member finds himself in such a challenge is in a pastor's office. And so after we have gone through the session with an individual, we weigh and see what to do next with the individual. Many a times we refer them to the experts. One of the things that we have to do as a church is to accept that we face these brothers and sisters. They live in and among ourselves each and every day. They come to services every Sunday. We meet them out there. We minister to their family members. We have to accept the reality that these are our brothers and sisters, and we need to reach out.
The government, I think, is trying. Actually, it is trying, because a patient with an HIF card can access these drugs at a cheaper cost in Mathare specific.
Na ni nini ambacho tunafaa kufanya ili tuweze kukabiliana na ugonjwa wa kiakili siku za usoni?
If we could get a mental health patient off the street by empowering the family, we empower community health workers to deal with mental health at the grassroots, because not all patients of mental health need to end up at Mathari Hospital.
For me, it's a policy issue. One, the government needs to look at the policy issue, and especially when it comes to the mental health. Then mental health needs to be given almost the first priority, given that the mental health is increasing day by day, and we are living with it and staying with it in our homes.
Asante sana msikilizaji kwa kunisikiliza, na karibu kwa makala yangu. Jina langu ni Lewis Monywa.